recording. So as I said in the description of the workshop, this is not going to be yoga therapy. This is not going to be in-depth clinical applications of how we use yoga to treat the hip or to get therapy in the hips. We really want to try to understand what part the hips play in the rest of the body, because they play a pretty substantial role. And oftentimes people don't know what kind of substantial role they actually play until we get into some of the details. So you don't have to have an anatomy background to this. And I'm not even going to insist that you memorize any of the anatomy. We're going to go over the more, I guess, perfunctory general concepts of the anatomy. But I want you to try to understand it in terms of your movement and your experience as anatomy is applied. Okay, so before we do that, let's just have a little quiet time in the spirit of yoga, just to kind of get all of our pieces together, our mental, emotional, physical faculties. So sit comfortably. You don't have to sit on the floor. You don't have to sit in a proper yoga posture, or a classical yoga posture at least. You can sit in a chair. You're upright, and your knees are below the hips. So prop yourself up if you need to. Just make sure your knees aren't higher than that. That's number one. And so right away, we're already beginning with the applied information of how the hips play into the rest of the body. So you relax your arms down to your lap, keep your spine upright, and then close your eyes. And if you're not comfortable doing that just quite yet, then take your time to do it. What's useful is to relax the face initially, and then eventually allow the eyelids to naturally come to a close. And in a way, we're mimicking a facial expression that comes up very naturally, very reactively, as it were, when we enjoy something. And we have these glimpses of savoring experience of either music or delicious food, or even just a feeling like a hug from a loved one, where we momentarily close our eyes. And so as soon as your eyes come to a close, notice which direction your eyes are pointing and direct them more in the downward position, as if you were looking right into the floor from behind your eyelids. And then notice just your platform. Notice how your butt bones, the sitting bones of the pelvis, how they're starting to connect to the surface that they're on. And notice if there's a difference between the left and the right sitting bone weight bearing, weight distribution. And as you even out the lateral weight distribution across the sitting bones, whatever you're sitting on, try to slide yourself just forward enough to the edge of your object, your pillow, block, so that the front portion of your sitting bones are almost right off the edge, almost coming off the edge of your support. And we do this so that we actually leverage gravity to pull the pelvis, and we'll talk about this later, in a forward direction, which should feel like a little hint of your butt sticking out. Right? So you think of if you're sitting upright like this, and you were trying to stick your butt out behind you, and you can try to do that aggressively first. But then if you just dial that down, you want to retain just a little hint of your butt sticking out. And so most of our practice with yoga comes to this whole notion of foundations, which is really most of the work. If we establish foundation, everything else seems to stack up that much more. And keeping your eyes closed, those of you that are coming in, we've already begun, so make sure that you get yourself a quiet seat. When we establish the pelvis on the support below us, that establishes integrity to the entire spine. And I would just ask you to think of this analogy of a stone stack or a rock stack. If you haven't played with one, then you've definitely seen one. And what we know about a rock stack like that is it takes action to set it up and to line everything. But if you get the center of gravity of each rock on top of the other just right, then it'll actually support itself. So then it doesn't need outside forces to manage its posture, its shape. It's just really a relationship to gravity. In the same way, this is the relationship we build in the sitting position, where your pelvis and hips are the bottom step. And having that set right, you can actually start to remove a lot of the other tensions that we usually hold in the torso, and the body stays perfectly upright. And this is really a posture, not just a physical concentration, this is psychological, cognitive focus posture. Let's not forget that one of the primary reasons that we love this practice so much is because of these cognitive and emotional properties, blessings that is imparted to us just by simply understanding how to move the body. And so this alignment is between function and experience. And now as we're gathered here today to gain a little bit better understanding of how this whole system of the body works, remind yourself what that's in service of. Remind yourself that really, essentially, what we practice yoga for isn't actually to just get better at yoga. The purpose is to have a more enhanced and intimate experience of our life. Yoga supports our living experience, our lived experience. Yeah. And then as we slowly now emerge out of the internal sphere of body sensation experience, you can slowly begin to open your eyes. Make sure you don't open your eyes too quickly so you still have a good sense of quiet and solidity within your body. Still keep your posture upright. And let your eyes, as they slowly crack open, let them adjust to the light around you. And as we're now a little bit more ready to take on some more information, and I know for some of you this is review information. Either way, it's good to review things, it's good to learn things from a new standpoint. You've been practicing for a long time, longer than myself, I think, at least one of you. So let's begin with the handout. So whether you have it on print or you have it on your device, let's just open it up. And what I first want to just bring your attention to is this, the first picture. Now, this is oftentimes, and remember, jot down notes, whatever you need to, even if it's repeat information, it's good to just write things out because there's actually interesting studies on it. We retain better information if we actually use our hand to jot it down, right? So if you want to remember something, you write it down, and you won't even need to reread it oftentimes. You won't even have to look at your notes. Just by virtue of moving the thought through your body and through your muscular system, it'll imprint a little bit better into you. So, this, or I can even do this. I have a little hip model. Okay. So this, what people usually call the hips, people put their hands on their hips, is actually the pelvis. So the hip, as far as this picture goes, is just where here, the femur bone, your leg, plugs into the ilium. And the ilium is one half of your pelvis. So if you put both of those together, those are your whole pelvic girdle. And so we want to make a distinction between the pelvis, the ilium more specifically, and the hip joint, because when we move the hip, when we articulate the hip, we're not necessarily articulating the pelvis. So the hip is just the small socket right here where the thigh joins the pelvis. So that's number one. So on this more or less live model, this blue, that's the hip. And those are the articulating surfaces of your hip joint. This is your thigh bone, femur. And this right here, the groove, the socket, is the socket of the hip, the acetabulum. Okay? And then you move your legs in all different positions. And we'll go over that in a moment. And if you turn to your official page 1, I wanted to start out with this aphorism. And it's the first stanza of the Hatha Yoga Pradipika. Hatha Yoga, those of you that don't know already, isn't actually a style of practice. It's not this modern version of a gentle, easy flow. Hatha Yoga is the physical yoga. It's the practice of yoga postures and pranayama techniques. So that's Hatha Yoga. And so the translation of Hatha Yoga Pradipika is just light on Hatha Yoga. And this was codified around 1300 of the Common Era. But these postures and these movements go further back. It was just they were compiled in a single treatise that then became called the Hatha Yoga Pradipika. And what it starts out with has to come into alignment with what it is that we're here to practice. And so salutations to Lord Shiva, who expounded the knowledge of Hatha Yoga, which is like a staircase, the aspirant to the high pinnacled Raja Yoga. So Raja Yoga, otherwise known as the Ashtanga system, the 8-limb path. what it says is the practice of all these physical techniques and postures is created in order to bring balance and homeostasis into our physical state, our physical structure, in order to actually have our mental and cognitive, psychological, emotional faculties in balance so that we can actually live life in a way that's meaningful, in a way that's ethical, and healthy across every single measure of health. Because we have physical health, we have biochemical health, we have psycho-emotional health, and for those of you that are inclined, we even have spiritual health. And what this basically says is pretty remarkable, because this was before the advent of science and before we got to discover how neurology and muscular physiology influences our brain. What it says is we have to get the foundation balanced. We have to get the substance, the physical structure to be sound in order to actually feel good. So we're remedying the body, but not for its own sake. We're doing it so we can actually have a better lived experience. And that's why I said in our first little meditation is that the concept of yoga doesn't actually exist to just get better at yoga. Now, of course, as you keep repeating something over and over again, your body adapts and you get better at the movement, you get more flexible. But the end game is not to do the splits. The end game is not to be able to do a drop back. That's just an adaptation that happens over time. The end game, right, as I already said, is to be able to have a better lived experience. Yoga is in service of life, and it's not life that's in service of yoga. Okay, so in the next paragraph, I just explained briefly what and why we're talking about the hip joint. I wanted to have this first workshop online about on the hip joint, because if you think about the hip joint, it is the bridge between your upper and lower body. It is how the legs connect to your torso. So it's essentially how your legs connect to the spine. Now, the spine is the house of your central nervous system. The spine can't have integrity and balance if it has a flimsy foundation. And so that flimsy foundation comes in either weakness of the legs, which then contribute to weakness and tightness in the hips. So by using our legs, we're actually rehabilitating and enhancing the function of our hips. So just like I showed in this model, this is your leg bone, and your leg bone is one half of your hip joint. So that means you can't actually have a hip movement without having a leg movement at the same time. Nor can you have a leg movement without it being simultaneously a hip movement. So standing postures and focus, emphasis on proper mechanics of the legs, that's what actually trains the hips. And so this is the bridge between the upper and lower body. If there's ever any imbalance in the hips, and there is actually quite a bit in modern day, the forces coming up from the ground when you take each step, when you walk or run or even sit, they don't translate efficiently up to the spine. So you can think of your legs and your hip especially as the shock absorber for the spine. So if your hips are stiff or tight or weak, then the shock absorption that your spine usually receives gets mitigated. And so what we see in modern day life is most incidents of low back pain, most incidents of sacroiliac joint, SI joint pain, are the outcome of having some kind of imbalance in the hips. Right, so you can think of the analogy of a car. If you have flat tires, it doesn't matter what kind of engine you have, it doesn't matter what kind of an interior you have, it doesn't matter what kind of rims you have. You can have a killer paint job, you can be driving a Rolls Royce. You can be driving a Ferrari, but your Ferrari isn't going to get anywhere if you're on flat tires. So we have to have our tires, so to say, on track, filled up, and healthy in order to get this damn car anywhere. So the next part about the hip joint is it's a ball and socket joint. There's different kinds of joints. So this is a ball and socket joint. There's pivot joints, hinge joints, planar joints. The hip being a ball and socket joint means that it's deep, right? So I can actually unplug this a little bit of my model if you watch. So you see how I can decompress the hip. You see how deep that socket is? All right. And you see how deep the femoral head is. Now what that means is it's stable. So you have almost the entire femoral head be completely enveloped by the socket of your hip. So your hip has evolved to be stable fundamentally because your spine needs stability. It can't be a flimsy joint like the shoulder. So different than the shoulder evolved to have more mobility and range of motion, but it lacks natural stability. And the hip has evolved to have more stability, but not as much flexibility, because stability is the priority into supporting the spine. And there's different kinds of stability. We'll talk about the muscular stability in a little bit. So when we talk about a joint being stable, right, when you have a structure that is supported by a shape, that's what's called passive stability. Passive stability means you don't actually have to engage your hip, you don't have to engage your legs in order for the hip to still retain this ball and socket shape that gives it stability. So it's passive because you're not having to interact with it to make it stable. So passive stability is how your bones attach to each other, and it's also how your ligaments attach joints. So those are very important two passive structures, as opposed to active stability is more on the muscular side. Because the hip is this intermediary between the lower body, which is how you experience the earth and the ground, and the spine, it has a lot of muscles passing through it. So more than any other joint in the entire body, this joint has the most muscles crossing it, right? Depending on how you count, it's a minimum of 16 muscles that directly interact with the hip joint and pull it in all different directions. Now I said that the hip joint is stable, okay? It's really evolved for stability and not so much mobility. But what we also have to understand is because it's a ball and socket joint, right? Like unfold the elbow or your knee, which you can only just flex the elbow one direction, and that's it. Right? I can't take my forearm and bend it the other way. I would hyperextend my elbow. Right? I can't really rotate my elbow. I can't do a lateral bend at the elbow. It's just one hinge, like your door hinge. Your door hinge allows things to move one way. So what I'm saying is, because of the shape of this joint, it's meant to be able to move across all three planes of motion. Right? And for those of you that need a little bit more explication on that, so you think of a two-dimensional object is like a piece of paper, right? It has height, it has height, but it really doesn't have width. So it's the X and Y axis, that's a two-dimensional joint, two-dimensional plane, but the hip moves in 3 dimensions. So your elbow moves in just 2 dimensions, okay? Now your hip moves in 3 directions. So 3 planes, 6 directions, but 3 planes of movement means it moves along the X-axis, the Y-axis, and then it rotates across the transverse plane, or you can call it the Z-axis, those of you that are a little bit more mathematically inclined. So the hip is a very polyarticular, which means it articulates in many directions, joint. And even though it's not built for mobility, it can still move in all these different directions, which we're going to review today. And the last thing about the hip, because it is this bridge between the upper and lower body, and I already said a little bit about it, many other dysfunctions that occur above the hips and below the hips are because of some imbalance in the hip. When you look at knee injuries, right, you have meniscus tears, patellar tendon pain and dysfunction, quadricep tendon pain and dysfunction, improper tracking of your kneecap, even ankle imbalances and weaknesses are really perpetuated from the hip. Because if your hip is stiff, it's going to limit how well your knee and your ankle move, right? Because your hip continues with the leg. And same goes for the upper body. The large incidence of low back pain that we have all across the world are really to be laid at the feet of inadequate hip movement. So, if you look on page 1, now to the structures and landmarks, and you can see that on figure 1, so if you just want to flip to the next page, I list out everything that, all the structures that we need to know about, and we'll feel them in a moment. So I already said the ilium is one half of your pelvic girdle, right? This big, almost like figure 8 looking bone. The femur is your thigh bone. Now the acetabular fossa, as you can see in figure 1, fossa just means space. So that is the socket of your foot. That's the fossa. So fossa means it basically goes in. There's space. It doesn't protrude out. Right? Fossa is more of like the feminine end of the joint. Now cartilage, I think we all know what cartilage is. Every joint has to have cartilage. So those are the smooth fibrous tissues that cover the heads of your joints and the sockets of your joints, the articulating surfaces, in order to be able to facilitate a better glide. Now, when we have long enough imbalance in the hips, this compresses the hip, and over time, you start to wear out the cartilage, and that's called arthritis. So most of the time what happens is because the muscles, especially your psoas muscle, become so chronically tight that it jams the head of this femur into the socket. So you see how I'm pulling the femur out of the hip? But when your hip is compacted, like tight muscles, this femur just jams right to that hip socket. And over years, as you walk or even do yoga incorrectly, you just start to smash and rub that cartilage until the damn thing moves out, right? And then you get arthritis. So we want to be able to decompress the hip, again, going back to what I said already, because naturally the hip is made to be compact and stable. And so the tendency is usually for the hip to get compacted and compressed. So we got to decompress it, and we decompress it with movement. Okay, the labrum. If you see there on figure 1, page 2, the labrum is another form of cartilage. It's more of a soft cartilage. It's a fibrocartilage. And it covers the rim, as you can see in figure 1, the rim of your acetabulum, right? So the rim of your hip socket, the outer edges. Now, it's meant to be able to cushion the movement of the hip so that your hip doesn't just bounce around in the socket, right? It actually has a nice, smooth envelope in it. So it helps to envelop the head of your femur a little bit better. Okay, the next part is the ligamentum teres. Now, this is a really important ligament, and that is going to be, yeah, it's also right there on figure 1. If you look at the head of the femur, you see that little white thing coming out? So that's the ligament that comes out of the center of your femur. So here on this model, if I bring it close, you can see it's attached in that same place by this little rubber band. So it's exactly the same place as where your ligamentum teres comes out. Now this is a ligament, and it's not exactly a ligament, it's pretty interesting. It's both a ligament and it's also a part of your blood supply to the head of the femur. So it has two things going on. Ligament, as any ligament would do, it stabilizes. So ligaments are passive structures that, first of all, are not very richly vascularized. That means they don't have a rich blood supply. So you have to be very careful when you're stretching and moving so as not to destabilize and create too much flexibility in the ligaments, because ligaments are meant to be kind of tight and hold your joints together. If you destabilize the ligaments, it takes a long time for them to be able to retain their previous shape and integrity. And usually people don't even know that they have loose joints. So they keep stretching and stretching, because as yogis, we kind of usually have this impression that stretching is the panacea for everything. If I feel pain, anything that goes wrong, stretch, 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 stretch. Now, if you keep stretching like that, you will inevitably destabilize your joints, and that lack of stability will then start to aberrate and create arthritic symptoms and conditions. So the ligamentum teres isn't meant to be stretched. So this is why we have to be so careful on how we move and stretch around the hip, because if you stretch the ligamentum teres, then it'll lose its stability. So then, say as you walk throughout your day, every step you take is going to be happening on an unstable, lack or minimally enveloped hip that's going to rub the inside of that socket the wrong way, so to speak. The other part of the ligamentum teres, as I already mentioned, is it has a little artery or capillary that goes right through the middle. So it supplies blood to the head of your femur. And what's been the case, maybe you guys have heard of this before, is for a lot of yogis, especially a lot of senior teachers of certain methods, because they get so involved into opening, whatever opening means in this case, opening and stretching the hips, they have stretched this ligamentum teres to such an extent that now it doesn't get to accomplish its job in supplying the head of your femur. What? Because your bones need blood supply in order to keep their integrity, in order to retain their function. So if you overstretch that ligamentum teres, you won't only destabilize your hip, you'll actually suffocate the blood supply to your thigh bone, which will then start to degenerate all of your bony tissue. So we want to stress that. Very, very careful and conservative with how we move it. Okay, now the articular capsule. This oftentimes is not spoken of as much as it should, and that's in figure 2. So if you look on figure 2, this is basically what you would see if you cut your thigh muscles open and look directly at your hip. So this is not actually how your hip looks, or it's not all that your hip looks like in the body. It's covered by a capsule, which is another form of a ligament. And this capsule is an even bigger envelope to the whole joint. So this is another passive stability structure, because you can't contract your hip capsule muscles voluntarily. So what you see here is from the bony structure to the ligamentous soft tissue structure of your capsule, What your hip is telling you, what the anatomy of your hip is telling you is, I want it to be stable. It's meant to be a stabilizing, dense kind of joint. We just don't want it to make it too dense and compressed. So the hip capsule can then in itself either become restricted or what's called lax, which means too flexible, which is another thing that can destabilize the hip. And we can't really palpate it, can't really touch it and feel it, but that, so you know, is what your hip is covered inside of, which goes right to the next point of the synovium. If you see again on page 1, the synovium basically encapsulates, the word itself, it encapsulates the whole container of your joint, right? And a lot of our body, most of our joints are synovial joints, which means that they have synovial fluid, which is the grease of your joint. So if I were to cut this capsule open, what would happen is a bunch of that synovial fluid would pour out. So that's the grease, like the oil, as it were, of your hip joint. And we improve the synovial function, the production of synovial fluid to joints when we're moving. So it's movement that produces synovial fluid and synovial rinsing. So if you have a more sedentary lifestyle and you don't move your joints, especially if you don't move your joints through the entire range of motion that they're meant to be moved, your joint gets restricted, and then it doesn't have any circulation inside of it. So the synovial fluid doesn't really get to renew and refresh, and so it just kind of stagnates, just like your blood would be, right? If you just sit on the couch all day, you're not really gonna have good circulation, and so you're not gonna have good transportation of nutrients to your muscles or your joints, nor removal of waste product. So movement is the ideal way to keep your joint structures and to keep your joint fluidity functioning better. It can only happen through movement. And then the bursa, which is the last of these passive structures. The bursa are little fluid-filled sacs that are meant to cushion how your muscles connect to bone. So if I could just show you this real quick. So there's a big bursa that oftentimes has some kind of pathology associated right here on the outside of your leg bone. So if you want to do this right now, might as well go over this structure. And you can have it, you can see it on figure 1 again. So this is your femur bone, okay? So we got to talk about this, make sure that you know, this is your femur bone, highlight it, write it down, make sure you know it. And you see this here, this little knob, that's also shown in figure 1. That's called the greater trochanter. So this knob is important, and its shape allows our muscles to be connected to it. So when those muscles contract, they will pull your leg and hip in their own relevant directions. And then this thing right here, so this horizontal, more horizontal part of your femur bone is called the neck of the femur, right? So this is your femur, and this is the head. So right before the head, you have the neck. And again, the neck of the femur is very important for us to identify as we then go on to learn how it implicates or is implicated in a lot of other movement. Okay, so those are the passive structures. Any questions so far on those passive structures? Anything I didn't say well, anything I could repeat, anything confusing? And right now, if you're just getting a review of it and you already know all this stuff, you know, still might be a good idea to write it down. But on the other hand, if it doesn't seem very clear, just ask. I know that as we get going into movement and as we start to cover now the active portion of our joints, you'll start to see how these passive structures, the passive structure, the bones and joints of your body and hip, how they get a little bit more relevant as we cover these muscles. Okay, so let's just go into the muscles, which is right here again on page 1. So I already said the hip has 6 different directions of movement. You have flexion, extension, abduction, and I list out the key muscles that control this movement. So if you look at flexion, you have 2 primary muscle groups. The rectus femoris is the central part of your quadriceps. It's one of your quadriceps. It's another polyarticular muscle because it crosses 2 joints. Your rectus femoris crosses the hip to the thigh, but it also goes down to the knee. So what you can write under rectus femoris or next to it is it flexes the hip, but it also extends your knee. It straightens your knee. The iliopsoas muscle, or oftentimes for short called just the psoas muscle, are your actual hip flexors that most physical therapists or practitioners refer to when they say hip flexors. And this is a very interesting muscle. If you go to now page 3, I put an image of these hip flexors right up at the top under flexion. And so the image on your left, right, this image right here, where you can see the pelvis and the lower back, what it shows is that that psoas group, it actually originates from your lower back. So the muscle attaches your lower back. You can see it goes through the pelvis and attaches, if you look close, right, if you trace right here, if you trace where this muscle attaches, it goes to the upper inner thigh bone. And where it attaches is a place called the lesser trochanter, right? So you have your greater trochanter here, that's the big knob, greater, and then you have the lesser trochanter, that's the smaller knob, right here on the inside of the hip. So those are your hip flexor muscles. What this means is that hip flexion and spinal extension, they tend to fall into the same category of movement. So hip flexion and spinal extension. We'll see what that means once we get there. Now the next part are your extensors. There's 2 main extensors. The primary hip extensor, you have to know this because there is a widespread disservice that's given to the glutes in a lot of methods of yoga. So the gluteus maximus, this big muscle, you can see it originates at the top of the pelvis, and it doesn't actually attach to hard structure. It attaches to this lateral band of ligament called the iliotibial band, the IT band. So your glute starts at a firm structure, but it attaches to more of a softer structure, the ligament. So what that means is your glute, it extends the hip and it externally rotates the hip. So you can write that as another action of the glute, is it extends plus it externally rotates the hip. It's an external rotator. Now the secondary, or another basically pair coupling to your hip extension, are your 3 hamstrings. Now we don't need to really go over where each of the hamstrings is or how they differ in their functions and their attachments. All we need to know is they originate right here at the bottom of the pelvis, your sitting bones, and they attach down below the knee. So that means they extend the hip as well as flex the knee. So they do the opposite of your hip flexors. They do the opposite especially of your rectus femoris muscle. They bring the leg away from the torso and then they flex the knee. Okay. At the bottom of page 3, you have your abductors. So we're going to go over, like I said, we're going to look at how all these movements actually feel. But your abductors are located, you can see it from this image, on the lateral part of the hip. So if I show you this model, it's right here on this lateral part of the hip. They all originate at the lateral part of your ilium and attach to your thigh. So what they do, they have two functions. One is they abduct, that means they bring the leg away from center, but they also internally rotate. So write that down, and then once we actually look at what this means in terms of movement, you'll be able to see how that plays out. So it's an internal rotator, they're primary internal rotators and primary for abduction. That means they have two big jobs. And your abductor muscles, make a note on this as well, are oftentimes muscles that lack strength and stability, which then precipitates arthritis at the hip joint. And they did an analysis of a lot of subjects through different studies. And what was shown, actually did my thesis on this, was that glute and abductor muscle weakness are the #1 things that are responsible for degenerating hip structures. So that means the two most important movements of your hip that we have to know, we have to practice, are a strengthening of the glutes and the abductors. So it's not actually stretching of those muscles that's going to keep the hip in balance. It's strengthening of them, right? And the clinical data on this is pretty clear. It's weakness in the glutes and weakness in the abductors that leads to imbalance of the hip that then perpetuates into arthritis. So extension and abduction, I really want to highlight for you. And this is what we're going to be practicing the most today. Okay, now next, if you turn to the next page, page 4, is you have your adductor group. So there's 5 main adductors. And let's just talk about this real quick. So abductors means the abducts, right? Like alien abduction. It takes your leg away from the body. So if I take my arm here and I move it out to the side, I'm abducting my arm away from the midline of my torso. If I bring my arm back, as the word suggests, add, A-D-D, I'm adding stuff back to center. And you can see this, it's not really memorable to see this acronym, PBLMG. So maybe to inject a little more humor into this, here's how you can remember these adductors, excuse me. If you want to remember them, you don't really have to, is P is please, B is babe, L is love, M is my, what's the G? The G is groins. Please, babe, love my groins. And so that basically shows how these adductor muscles, how they manifest in the body from top to bottom. So they go from shortest to longest. Pectineus, abductor brevis, brevis means short, like brevity. Longest means long, adductor longus. Adductor magnus is the next longest one. And the gracilis muscle, that's the last one. And that adductor attaches below the knee. So the secondary function of your gracilis is to flex the knee joint. We don't really need to know that, but if you want to jot it down, it won't hurt. Okay, next is going to be your external rotators at the bottom of that page. So we already talked about how the glute, the gluteus max, is your primary external rotator. Now what these deep 6 hip rotators are, and again, you don't have to remember them, they externally rotate, they stabilize external rotation of your hip. So if you, again, were to just look at your body, if you were to do a dissection of your body, the glute would be covering these muscles. So on this side, if you look underneath this glute, you'll see the deep external rotators, the deep rotator stabilizers of the hip. And so here, what's important for us to understand is there's two types of muscles. One group are called stabilizers. And that's what these deep six are. The deep external rotators are the stabilizers of your hip. Stabilizers always means they're the closest muscles to the joint. So the muscles immediately covering a joint are your stabilizers always, because they stabilize the exact position of your joint as you take it through big ranges of motion. So if you flex the hip, if you flex your leg forward, the deep six will work in concert to make sure that the surfaces here, the articulating surfaces between the hips, are held together in proper congruence, right? And so if we're all clear on this, congruence means in good relationship, they're congruent with each other. So this is congruent, and if I do this, this is incongruent. So you see the blue surfaces, when they're out of contact, there's less congruence, meaning less stability. So your stabilizer muscles are deep muscles, and what's also really good to notice and know about them is you can't really voluntarily control them. That's the thing about your movement and about how the stabilizer muscles plays into movement, right? So if you're doing, say, a standing pose like tree pose, you can't consciously communicate to your stabilizer muscles in the hip. They are going to be automatically, they're autonomic. That means they function outside of your conscious control. They automatically stabilize your hip from more of your subconscious reflexes. So their actions are actually, how would I say it? They're recorded in your spine. So your spinal reflexes are what controls your deep stabilizers. Now, that doesn't mean that you can't train your stabilizer muscles. You can isolate and train them. You just can't actually control them in the context of a big movement, in the context of doing a back bend or a forward bend. All we can consciously control when it gets that complex is the big muscles, the main muscles, which now brings us to, as opposed to stabilizers, now your global movers or your mobilizers. So the global movers are, by association to the external rotation, are your glutes. So when you're doing a back bend like cobra pose or upward dog, all you can control is the output to your big glute, your glute max. So it's those muscles that actually move your joints and that you control voluntarily. So they are the global movers. So when you have gross movement of, say, lifting your arm, that is not controlled directly by your rotator cuff. The rotator cuff supports the subconscious balance of any joint as it moves through that range of motion. So another way to understand it, the rotator cuff of your hip are those deep six stabilizers. Just think of that as the rotator cuff. And the rotator cuff, so we know, are just a collection of muscles, basically. Okay, and then finally, what you have here is the internal rotators, and as I said already, your internal rotators are also your abductors. They are not a different set of muscles. They are also your abductors. And by this time, what I hope that you guys have noticed is that any muscle group, flexion, extension, abduction, adduction, always shares its functions with other muscle groups. So hip flexion oftentimes shares its load with hip adduction. So a single muscle group, more than one muscle group, is oftentimes used in a single posture. Okay, and right below that is now the pelvis. You can't really talk about the hip, like I was saying in the beginning, without talking about the pelvis. And this is just a diagram where you see the arrows and the muscles that shows a posterior tilt. And I said that there's 16 muscles that cross the hip joint and affect it directly, but more muscles than that affect it indirectly. And so if you can see here on the front, this is your rectus abdominis. This is a part of your abdominal muscle, your core muscle, that attaches to your pubic bone and pulls the pelvis up, thereby affecting a movement at the hip. And when you engage your glutes and move your pelvis, by moving the pelvis, you're simultaneously moving the hip. So we can't really study hip joint without also knowing something about the pelvis, because the hip joint exists within the pelvis. And then next to that, you have these three images of a lateral pelvic tilt. So these lateral pelvic tilts are something that comes into play when we're doing certain standing poses like side angle pose, triangle pose, warrior two, things like that. Okay. Now going on to page 6, position and movement. We already talked about all the muscles that control all 6 different directions of your hip movement. And in page 6 through 7, I just listed and put images of some of the most common poses that are implicit in each one of those 6 hip movements. We'll practice some of them, but it's important to know which muscles are the primary drivers of each one of these postures. Which muscles are the primary drivers of each one of those muscles? Okay, so let's stand up for a second and just feel what this means in our body. Okay. All right. So let's just start from simple stuff. Everybody, put your hands on your pelvis. And if I come closer, here's what you can do. Go a little bit high, so find your lower ribs, and then give it a good squeeze. And then keep going down, and notice when your ribs end, and you can actually squeeze in, right? So where it becomes nice and soft here, right? Between the top of the pelvis and the bottom of the ribs. See, here's the bottom of my ribs, here's the top of my pelvis, and it's squishy here, where your kidneys are. Don't squish too hard, right? Now, if you keep going down, eventually it gets firm again. So this, what oftentimes people call the hips, is actually your pelvis. So find where the top of those pelvic bones are, the top of your ilium. So what I'm talking about here is this part, right? This is your leg, hip, top of the pelvis. So you find that. So that's your ilium, now that we know. And then trace your hands around to the front, and you'll find there's 2 small projections of your pelvic bones right in the front. And they're a little bit more prominent in women because women have a wider pelvis, you know, to be a little bit more ready for childbirth. So these 2, this one prominent point of the hip is called the ASIS, the anterior superior iliac spine. We don't really need to remember that, but this is a part of the pelvis where your quad connects. So your rectus femoris connects to that and causes hip flexion. Now, if you go down from the ASIS, go to the side, of your hips. Put your hands right on the side. So here's what I'm doing. And then what you're going to do is you're going to bend, you're going to bend your left knee, keep your right leg straight, and then stick your right hip out. Right? So if I turn to the side, left leg is bent, right leg is straight, and I'm kind of jutting out my right hip. So jut it out, and then feel with your fingers where there's that hard bone that tends to stick out the furthest. So go down a little bit, go up a little bit, go to the side, just kind of feel around. This is how you get to know your body. And just see where the furthest projection is of hard structure. So that is your greater trochanter. So put your fingers on that. I would suggest put your first two fingers, index and middle, and then straighten both legs again. And here's what I'm going to have you do, just to see how it all works. So you're going to lift the front of your right foot, so just your heels on the ground. Keep your toes facing forward. And then turn your toes out to the right. Turn your knee to the right. And now notice what's happened underneath your fingers when you turn your leg out. So then slowly bring it back to center, and then slowly bring it back out. So just do that a couple times. Center, out. Back to center, and out. And you'll feel that your greater trochanter, it goes back and forth between jutting out, being prominent, and then kind of disappearing from underneath your fingers and turning further back behind you. Right? So what's happening here, just so you can see here in this more live model, is when you're turning your toes out, this greater trochanter that you had your fingers on, it kind of goes back, so it doesn't push into your fingers, which are still here. So your greater trochanter will always, the placement of it, will always tell you where your hip is, how it's rotated, and how congruent it is in your hip joint, in your socket. Okay, we can't really feel the fossa, the socket of the hip, but you know your thigh bone, so everybody knows their thigh bone, feel the thigh bone. Now, I'm going to turn to the side, find your glutes, go right to the bottom aspect of your glutes, and then bend forward so you kind of sticking your butt out, and then feel, again, those sitting bones. So I know a lot of you know this already, so your sitting bones are where your hamstrings originate from. So when your hamstrings contract, they pull the pelvis and the sitting bone down. Okay, so that's it for the passive structures. Now let's just go over each one of these movements. So we'll try to isolate it, even though it's never clean and isolated like that when we're practicing. So first is hip flexion. So stand on one leg, lift your leg up. So that's right hip flexion. And we're going to talk about this in more clinical terms, anatomical terms. Flexion means the front of a body part comes to the front of another body part. The anterior portion of my thighs comes to the anterior portion of my torso. So that's flexion. So when I lift my leg, I'm flexing the hip, bring the front of the thigh close to the front of the torso. So that's on one leg. But if you do a typical forward bend, again, hip flexion, this case means you're not lifting your thighs to your torso, you're bringing your torso to your thighs. So that's hip flexion. Okay. Now hip extension, show you from the side again. Just step your right leg back. So it's the opposite of this movement. Now, right, so if you do this, you can put your hand on your glute, like actually get a good grab of it. And standing on your left leg, move your right leg back as far as it goes. And give it a little external rotation. And you'll notice that as you do that, and you external rotate, the glute muscle in your leg kind of gets a little more dense. So you're activating the glute by taking your leg back into extension and external rotation. So the glute does both. Okay, we already talked about this before. The next part is going to be our abduction. So you can just put your hands on your hips, stand on your right leg, and then abduct like an alien, your leg away from center. Right? So your left thigh moves away from center. Now, if you put your hand again, right, so find the top of the pelvis there, the ilium that we started with. Put your hands, so if this is that top edge, put your fingers, dig in, just like a couple of inches, maybe 1 inch only, below the top edge. So what I'm saying is, find this top edge, and then dig your fingers just about here. So just a little bit below that rim. And when you dig your fingers in, now, standing on the right leg, take your left leg away from center, and you might have to move your fingers around a little bit. You'll notice that those muscles contract and relax. And as you move your leg away from center, they get a little more dense. You bring them back to center, they relax. You have those 3 abductors. Now, remember, part of your abductor group, it also internally rotates. So what helps your leg go out from center a little bit is if you turn your toes in. So internal rotation is when your toes turn into the body, your heel goes out. So that's the function of your abductor muscles, but abduction in a nice isolated state means toes face forward, you just take your leg away from center. Adduction, pretty easy, stand on the left leg. So you start from mountain pose, and then you bring your leg across the center. So it's the opposite of this. Leg goes across the center. Those are your abductors, those 5 big muscles on the inner thigh. That fun acronym that we looked at. Okay, now external rotation we already talked about in terms of the glute, but let's just try it anyways. So external rotation, lift the front of your right toes up and turn your toes out to the right. Try to turn your knee out as far as you can. Your knee and toes face as far to the right as possible. So that's external rotation. And you go the other way, toes and knee face left on the right side. Internal rotation.
Question.
Now last is the pelvic tilt. So you put your hands on your toes and then stick your butt out. Then stand up straight and pull your butt in. So when you tip the pelvis forward, when you try to stick the butt out, contract your quadriceps. And that's going to help you do that a little bit better. So what you see here is anterior tilt of the pelvis and hip flexion are pretty much one and the same. There's a few distinctions, but for our purposes today, they're pretty much one and the same. So that means any forward bend you ever do, the job you want to accomplish with your pelvis is to keep tilting it forward. So practically speaking, it means you're attempting to stick your butt out further and further and higher up. That means your pelvis is going to tilt better, and so your hamstrings are going to get a little bit more lengthened out. Now, speaking of flexion, there is a lot that is also perpetuated about micro-bending the knees. So what bends your knee or your hamstring? If you micro-bend your knees, that means you're micro-engaging your hamstrings. And if you kind of stretch your hamstrings, while at the same time telling them to contract, that's actually the best way to lengthen our hamstrings is to engage the quadriceps so that the hamstrings can lengthen. And if your quadriceps are engaged fully and efficiently, then it will be able to lengthen out the hamstrings, but your knees will be straight. So you can't have fully contracted quadriceps with bent knees. Your legs have to be locked. I'm not saying locked out, but locked. Now look at this and try to come out. I'll bring my knee a little bit closer. So stick your right leg out so you can see my quad. So this is my leg straight, see? But it's kind of locked out, it's relaxed. And how you can test it is, you grab your kneecap and give it a little one of these, little side-to-side wobble. All right, you see how my kneecap moves? That means here, the quadricep is relaxed, and although the knee is straight, it's straight in a passive and unsafe way. But then look at how my knee changes and look at how your knee changes as soon as you tell your quadriceps to activate. Right? I'm going to put everybody on mute. You're hearing a lot of noise. If you need to ask something, please feel free to unmute yourself, but there's just a lot of background stuff going through. Okay, so just try that a couple of times. So you relax your quad, contract your quad. Relax, contract. It almost looks like your knee frowns when it's relaxed, and then it smiles once it's contracted, right? It looks lively. And then when you contract your quads, you couldn't move your kneecap around if you tried. So the strengthening and engagement of your quadriceps helps to lengthen the hamstrings. So then posterior tilt is hands on the hips. And instead of sticking your butt out, then you pull your butt in. So you have to engage your glutes for that. So really try to squeeze and clench your glutes. You can even bend your knees a little bit for this one because it's not a forward bend. And then try to bring your tailbone forward, like between the legs, and lift your pubic bone up towards the belly. So that's a posterior tilt, which also means extension at the hip. You can't have a posterior tilt without at the same time extending your hip. So an anterior tilt contracts your quads, lengthens your hamstrings. A posterior tilt contracts your glutes and hamstrings, but lengthens your hip flexor line. So every back bend has to have within it a posterior tilt. That is the fundamental base of every back bend. You have to use your glutes because your glutes pull the pelvis down and then create room for your lower back, right? So you can see by its relationship to the opposite why you want to do this. So do a forward bend and now try to pull your butt in, right? So if I do a forward bend like this, you can see my spine, and I don't anteriorly tilt my pelvis, I try to posteriorly tilt it. You see what this does? As I try to pull my butt bones down, it rounds my lower back. And so if my lower back is rounded, two dangerous things are happening. My hamstrings continue to stay tight, my quadriceps aren't active enough, and then my lower back gets rounded and then takes on more pressure. And we don't need any more pressure and compression in our lumbar spine. So that's how you know how it feels, right? So if you do the opposite, you try to stick your butt out, now you'll feel lengthening at the hamstring side, and you'll feel a little bit easier, more flatness in your low back. So in the same way, you can go into extension, go into a back bend, just standing upright, and here, see how awkward it feels if you try to stick your butt out, right? All of a sudden, you'll compress your lower back. So you don't want to try to stick your butt out doing a back bend. You want to engage your glutes, pull your butt in, and that will actually take the top of the pelvis away from the lower back and allow you to go back further. So those are your pelvic tilts. So as long as we just remember for the purposes of what we're doing today, the two most important things for most of these poses. Flexion means you have to anteriorly tilt the pelvis. Extension means you have to posteriorly tilt the pelvis. Okay, and on page 6, you have just this diagram of what we did already. So that's each one of the 6 possible movements of the hip. So this is in its isolated form. And when it comes to yoga poses, then we start to tie in more than one muscle group and more than one action together. Which then brings me to a very important part of what are called arthrokinematics. So arthrokinematics, arthro means joint, and kinematics is movement, kinetic, is how your bones articulate, the shape of your hip articulates during any movement. So what we have to look at specifically here is the neck of your femur, and then right here, the rim of your acetabulum. So I'm just gonna have you look up here for a moment because this is really important. So this is the body, this is like my right leg, facing forward in neutral. Neutral means like this. Knee point straight, toes point straight. The ankle is directly in line with the hip. It's not like this, actually. It's like this. Okay? So, when you go into hip flexion, because of the shape of the hip socket, if you continue to stay neutral and you don't rotate or move your leg out of the way, if you flex forward this way, eventually, once you get past about 125 degrees, show you a little bit closer, the neck of the femur will begin to run into, right here, if you can see this, into this little rim, this part of the rim of your hip socket, which starts to crush your labrum. So that means if you go into flexion, and here's the interesting part. Everybody knows this pose, right? The standard forward fold, Paschimottanasana. Grab your feet, right? And then you just pull yourself down as far as you can. What it basically shows is we're going to be limited and we're going to be endangering our hip if we take flexion past 125 degrees without rotating the leg. So if you see, if I go, so this is 90 degrees. If I go a little bit further and I keep my leg neutral, right there, you see how those parts, they make contact. So if you want to go past about 100 to 125 degrees, you're going to have to externally rotate your leg, which is this rotation. And then you can flex the hip as far as you like. And now the neck of the femur doesn't ever get to run up against the edge of your hip socket. So you get to safeguard your acetabulum doing this. Okay, so that's in hip flexion. That's in most forward bends. We have a lot of forward bends in yoga, and obviously the incidence of hamstring tightness across the world requires us to know how to properly move the legs and the hip in deep flexion. Now, extension, we talked about in the back bend, is when you bring your hip back. And then same thing occurs, so this is looking from the back. If I extend the hip and I actually don't turn my leg, then again, you see the neck of the femur starts to run into the back portion of your hip joint, of your hip socket, right here. Boom. And so that starts to put a dent in your labrum, your posterior labrum, and we don't want that either. So what we want to avoid, let's just go over it, is deeper than about 115-degree flexion while keeping neutral adducted legs. So what does that mean in practice? You want to avoid bending too far forward, flexion, if your legs are going to be together, adducted, and not rotated. So the way that we get to create more space in the hip is if you actually turn your feet out slightly, or just keep your legs apart. And then you can flex forward, and you're not going to start to irritate the edge of your hip socket. Okay, now for extension, we want to avoid going into far external rotation. So when it gets to deep extension, which is right there on page 8, we're talking about it, under the heading of incompatible pairing of positions. You want to avoid external rotation because look what happens. As I extend the hip, now this is say going already to extreme, to deep range. If the hip externally rotates too far, you see how those blue surfaces start to lose contact? So you lose stability, you lose integrity, and you can actually start again lengthening and overstretching your ligamentum teres, your central femur ligament. Not only that, but you'll actually start to irritate your posterior labrum. So the way to extend more therapeutically is not to externally rotate, is to actually try to internally rotate. So again, I take the hip into extension, And once I get far enough into extension, you see here how the neck runs into the acetabulum. Internal rotation starts to look like this. And then the neck of your femur is clear. Okay. We're not going to talk about the 3 types of stretch reflexes right now, just because for time's sake. Now, the range of motion, just to go over this last part real quick. Range of motion, again, page 8. In yoga, what we're doing is we're challenging the limitations of our body. So we have certain muscular restrictions, and then we also have more passive structure restrictions. So you can be tight in a movement, like it says, limiting factors, because your muscles are tight and contracted, or it's because the hip capsule that we saw in figure 2 in the beginning, that in itself is tight and not flexible enough. So what you want to remember is this, write this down. The part of the hip capsule that is tight most often in people is the posterior hip capsule. So that means when the leg flexes, the posterior part of this capsule is so tight that the leg almost gets pushed out of the hip socket because of that tight structure. So how you can see it is this. Grab your pen or marker, whatever you have, and then put it about halfway in your hand, and then make a tight fist around it. So your hand is your joint, which includes your hip capsule. This is your leg. So the hand is the hip, the pen is the femur. If you push this down, but hold it tight, if you push this down, what you'll notice is that the part of the pen that's inside of your hand, it doesn't get to move much, right? So if you push down hard, it kind of stays stiff. It doesn't get to move all that much because your hand is so tight and restricted. Now, if you just loosen up your fist a little bit, and then you push down, all of a sudden you have much more liberal range of motion. So the tightness of your fist is analogous to the tightness of your hip capsule. So if the hip capsule is too tight, it's going to structurally impede how well your leg and hip moves. But if it's just loose enough, right, if I open up my hand, then you move your leg around, and that way the actual origin of that joint, it gets to move a little bit more liberally within the joint structure itself. So that's kind of the idea behind our hip capsule. So now we're going to get to the practice part. And if you look on page 9, here's what I want to try to really work on for the next half hour, 40 minutes. Is the most common dysfunctions of the hip. So most common dysfunctions means the most common restrictions. You can also think of it in those terms. So flexion. Flexion is probably one of the, if not the most common restriction of the hip. Why? Because of hypotonic hamstrings. We don't really need to know too much about hypo versus hypertonic. Whenever you hear either one of those, it just means tight. Hypotonic means it's weak and tight. Hypertonic means it's strong and tight. So let me just show you the difference. If I hold my arm here for, let's just say like the next year, right now I just flex my bicep. I just keep holding it here, and this is all I'm going to do. It's going to be really strong at this angle. But once I actually have to straighten my arm, or once I have to go through a range of motion that wasn't here, then it's going to be weak. So I won't be able to straighten my arm because this is all I've trained into it. So I'm going to be limited how far I can straighten. So this would be a hypertonic bicep that wouldn't allow my elbow to straighten. But hypotonic means it's underused. So that would be like keeping your arm straight for the next year, not sending any information or energy to the muscle, so then it's tight and it doesn't know how to flex. Or you can even think of it, if I just hold my arm here without contracting my bicep, if I just hold my elbow bent like this for the next year, keep the bicep loose, your body's going to start to adapt to this shape. So even though you're not using your muscle, it's going to tighten around this shape, because anything that you do repetitively with your body gets recorded into the body, and your body assumes this is what you actually want to do. So it'll lay down tissue to support that movement. So if your bicep is relaxed here for a year, then you try to straighten it, you'll be tight. You won't be able to straighten it all the way. And so that's hypotonic. So most hamstrings are hypotonic because they're not used enough. They're used in a very short range of motion, and oftentimes they're passive because most of us spend our entire life sitting. So as well as the glutes. I already said that before. Underused glutes are the #1 reason for many hip dysfunctions. And the next common dysfunction is extension. So that's overly contracted hip flexors, those psoas muscles. And again, usually comes from sitting, comes from being rounded over. You know, your hip flexors, your psoas muscles are the deepest muscle in the body. And because they're deep, they also have they have a property of an organ. They have more of smooth muscle texture, like your cardiac muscles, other organ muscles. So that means they have more of an endocrine function behind it. So they have a hormone eliciting, producing, and reacting property. So when fight or flight, any stresses hit us, a big jolt comes down to your hip flexors, to your psoas, and contracts them, because we've actually evolved in the context of if there's a stress, it means you have to move, right? It's only until like the last 200-300 years that human beings have been able to afford to just sit, even though we start to get stress laid on us. But for hundreds of thousands of years, whenever there's stress, that means get your ass up and move. Either run away from stuff or fight things. So those hip flexors have been programmed evolutionarily to participate and relate to your stress response. So when we have, instead of the stress of running away from a tiger, you have the stress of a credit card debt, then that constant stress, your body only knows there's a stress, I gotta move to avoid it, so I'm gonna contract, and so your credit card debt is then contracting your psoas muscles. Even though you're not actually moving, even though you're just sitting in a chair, you could be watching a movie, but the subconscious stress of your credit cards or your political system is then contracting your psoas. So you can blame your relevant political party for your tight psoas, you guys. Nobody created it but them. It's their fault. Okay. And then we're gonna skip abduction, because abduction, remember, plays into a couple of other movements, which is your internal rotation. We're gonna focus on flexion with external rotation. So that's another common dysfunction of the hip, which is the inability for the leg to flex, abduct, and externally rotate. So this is your pigeon pose. And the tightness of pigeon pose actually comes from those deep 6 hip rotators. So the inability to do that efficiently is one of these other common pathologies. So we have restricted hip flexion, restricted hip extension, and restricted hip flexion with external rotation. Okay, so finally, let's get to the practical part, because I didn't expect to be droning on for this long. Anybody have any questions before we get to it? So feel free to speak now. You'll have to unmute yourself, but you're gonna need a block, a blanket, and a belt. And I already said that we'll need a belt in the email. If you don't have a regular yoga strap, just grab a regular belt from your clothing, from your pants. If you don't have a regular clothing belt, grab a towel. All right. So let's see. Good. Just gonna move some stuff out of the way. So what you're gonna do is lay down on the mat. And we're just gonna go through some hip series real quick to show you, to actually get to feel what each one of these positions is and how it actually plays into the experience in yoga. I'm gonna actually set my computer down so you can see me more ground level. Okay, and I know many of you have done this before, so you're gonna unwrap your belt or your towel, whatever it is. You're gonna thread the belt, and it's very important, right around the center of your heel. Not this, not the arch of the foot, you gotta keep it right at the heel. And then hold at the same distance to your foot with both hands. Pull your right toes back towards you. And what's important right now, we talked about it before, is that your legs stay straight. I don't care if your leg can only come, say, like 1 foot off the ground, right? The depth of your flexibility is not the most important thing in this practice. So it's better to keep the knee straight and close to the ground than vertical and bent. But absolutely no bending in the knee. And this is oftentimes the most obscure and like elusive part of our movement. So everybody close your eyes and then really try to connect your mind, your active mental faculties to your quadricep. Engage your quadricep, straighten the knee, kick out of the heel, and pull your toes back toward your body. And just hold that for 3 more breaths. And I want you to just really focus again, kind of like really immerse yourself in what it takes to contract that quad. It might take a little bit of time for you to be able to keep it contracted the whole time. But that's where practice and repetition is the biggest blessing. So you keep your quad contracted, and over time, as your body adapts, you'll notice that you can start to pull your leg a little bit deeper into the body. A little bit deeper into the body while keeping the knee just as straight. And the degree to which you turn on your quadriceps is the degree to which your hamstrings will be able to release. It's safest to do all this stuff on the ground with this hip series because that's when your spine doesn't have to suffer any consequences of too much compression or unnecessary movement. Okay, switch legs. So now just switch off, pass off the belt from your left foot to your right foot to your left foot. Again, try to hold closer to the foot on the belt. Straighten your leg, even if it's way below vertical. Vertical is not that important. Keep the leg straight. Pull your belt deep into the heel. So what you want to feel also is the action of your arms plugs the leg down. So close your eyes, engage your quadricep. And now I want to tell you about that hip capsule that we talked about. When you pull down with your arms on the heel and you feel that that registers in more pressure in your left butt, right? The butt of your left leg that's lifted. What you're actually doing is you're pressing the head of the femur backwards, right? So you're kind of starting to explore a little bit more flexibility and starting to remove some of the restrictions of the posterior hip capsule. And I said already, I had you write that down, that the posterior hip capsule oftentimes has the most common restriction. So it's not only pulling our leg towards our body, but you actually want to pull your leg down into the floor as a way to get a little bit more mobility out of the capsule. Okay, so that's. Okay, now this time I'm going to turn this way towards the camera so you can see which way my leg is going. I want you to hold both sides of the belt in your left hand. And then cross your right leg over to the left just a little bit. So what you can see on the camera here is my foot is in line with the left side of my body. Make sure you don't take your foot way past it. You don't want your right butt to be lifted off the floor. Your foot can either be vertically above the thigh, the hip, the ribs, or the shoulder. In the same way that you did the previous pose, make sure that you're still pulling down with your arm, even though your leg is in a diagonal,
So you should still feel pressure registering on the back of your right glute. And that pressure comes from tugging down on the leg. So you have a vertical pull down using your arms while still keeping your leg at this diagonal. This starts to hit your muscles, your abductor muscles. So our first pose is basic hip flexion. This is adduction, adduction. And so when you're doing flexion, you're stretching your extensors, because the opposite of flexion is extension. When you're strengthening your adduction, as we are here, you're stretching your abductors. So this is getting more mobility in the abductors, as well as the external rotators. Switch legs, try the next side. And just notice as we go from side to side in these poses, what leg feels a little bit more restricted, and what hip feels more restricted as we do this side to side. So you hold both sides of the strap in your left hand, and then pull, your right hand, pull your left leg over to the right. Make sure again that your left foot is vertically set above the right hip, right thigh, right ribs, right shoulder, doesn't matter. Do not let the left butt lose pressure from the ground. Pull down on the belt so you can feel those downward force translate from the heel all the way back into the floor. And so now notice what the difference is between your left abductors being stretched versus the previous side on the right. Still keep the quadriceps just sharp and hard engaged. The dexterity and intelligence of your quadricep contraction is going to be what makes the biggest difference to your hamstring. And your knee health, don't forget. Because the main thing that informs your knee are your quads. Bring your leg back to center, switch sides again, pass the belt off to the right heel. So this time, you turn this way actually, hold both sides of the belt with your right hand. And first, we already practiced this, externally rotate your leg. So that means try to turn your toes and your knee to the right. So you can see in the camera, my toes and my knee are turning to the right. Now once you get as far as you can with that, start to lower your leg down, and as your leg lowers down, continue trying to turn your toes to the right. So your toes and knee are attempting to face the floor. And once your leg gets close enough, you don't actually have to bring it all the way to the ground. Make sure that you stop as soon as your opposite glute and hip start to kind of move off the ground. You can prop your right elbow on the floor, and then same way that you did before, pull on the belt so that you're, in a way, plugging your leg right back into the hip. So we have abduction here. So that means if you're practicing abduction, you're stretching your adductors. So how does it feel on the inside of your leg? Those are your adductors, the medial thigh. Inhale, come back to center, switch sides. Put both sides of the, pull both sides of the belt with your left hand. Okay, and then externally rotate your left toes and knee to the left. Make sure the belt is directly over your left heel. And then slowly start to lower your leg to the left. Make sure that you don't go past where your right hip can stay down. But keep attempting to turn your toes and your knee towards the floor. So this is external rotation. Remember, external rotation comes from your glute. So find a way to engage your left glute to help that external rotation come through a little bit better. I know there's a lot of actions here, so pull your leg with the belt back into the hip. Now how do the adductors stretching on the left side feel? Because you're moving into abduction, so you're stretching at adduction. Basically, this is triangle pose on your back. Inhale, bring your leg back up, put the belt down. Now I'm going to turn this way again. Start with your feet flat. Now we'll go into internal rotation. So you're going to lift the front of your right foot, put it out to the side, then lift the heel, walk that to the side, and just kind of shuffle your foot to the right until it goes about a foot and a half outside of the knee. Keep your foot in place and then lower the knee to the ground carefully. From there, place your left ankle on the top lateral aspect of your right thigh, and just let the weight of your left leg encourage the downward descent of your right leg. So don't push anything, just activate your toes, spread the toes. If your knees feel a little bit unstable, keep spreading, keep lifting your toes. Ankle stability, foot stability is one of the other main reasons that our knees can be out of balance. You'll notice that your pelvis might be sideways, your lower back isn't flush and symmetrical on the floor. Don't try to flatten your pelvis to the floor. Just allow your right thigh to slowly descend down. So this is internal rotation. Now this puts more stretch into your main hip flexors, your psoas muscles, the iliopsoas. Remember, we talked about how the psoas originates from the lower back and attaches to the lesser trochanter of your femur. So the lesser trochanter is your inner upper thigh, the uppermost part of your inner thigh. And here, when we're rotating the right thigh internally, we're taking that lesser trochanter insertion point further from the origin of the lower back. So that's how we stretch the psoas. And it's not a deep psoas stretch, but it's a nice intro. Take your left foot off the knee, heel and toe your right foot back. Okay? And then heel and toe your left foot to the left. Wait until your foot comes out about 1 or 2 feet. Drop your knee down, and then carefully place your right ankle on the left thigh. Again, activate your toes. What you can do is lift your head up, look at your left thigh. So like this. And if you look at your left thigh, you want to see that your left thigh falls in line to this whole side of your body. So you have a straight line from the knee to the armpit. And again, your pelvis is going to be sideways. You can see here the left side of my pelvis and my lower back is lifted. That's natural. Don't try to force it back down. This is more of a passive kind of stretch. We didn't go over the 3 different stretch reflexes, 3 different types of stretches today, because we're just trying to understand a little bit more about how each movement pertains to each muscle group. And I especially want you guys to walk away knowing how to enhance your various hip movements to be a little bit better. And a lot of that is, I'm sorry to say, is because there's a lot of misinformation going around about how the body works and how to move it properly. Okay, take your right foot off the left knee. Bring your toes back to center. Now next is external rotation. So you're going to place your left ankle on the right knee. Everybody knows this. It's like that number 4 pose, pigeon pose on your back. Except the difference here is you're going to lift your right foot, in front of your right foot, and you're going to heel toe it to the left. So now your right ankle is below the left knee, and your left ankle is on top of the right knee. And then slowly allow both legs to begin to come down towards the floor. Still keep your toes active. You can put your left hand right on your left thigh, and instead of pushing it down, think more about just pushing your leg away from the body. Right, now naturally there's going to be more bony structural restriction that you don't want to push past. We all have variations in how our bones and the angles of our femurs are congenitally shaped. So if you notice there's already a stop and it doesn't feel like it's a muscular tightness stop, it's just kind of a dead stop, you never want to force past that, because then you're creating conflict between those passive hard structures of your bones. And that's actually antithetical to yoga. Yoga is fundamentally a system of intelligent strength control. It's not a system of stretching. Right? Yoga is not synonymous with stretching. Stretching is a byproduct. Flexibility is a byproduct of yoga. Take your left foot off the knee, heel and toe your right foot back. Okay, and then right ankle on the left knee, heel and toe your left foot to the right, and then slowly again, lower your legs down, little by little. If you notice your lower back pop up a little bit, Just don't exaggerate it. You know, don't push your legs down so much that you then end up in like a fish pose or some kind of a cobra on your back. Put your right hand on the top of your thigh. Just push the thigh not down, but away. Like you want more distance between the thigh and the body. And this gives a little bit of that decompressive force. Remember in the beginning we talked about how a lot of the pathology that's suffered in the hip joint is due to its compression. It's just so deeply stuck and grooved into the hip socket that any movement becomes an irritant. So we want to decompress it. And of course, there's a happy middle. You don't want to decompress it too much because that's instability. You don't want to compress it too much because that's just compression and irritation. Okay. Take your right foot off the knee, heel into your left foot back, turn over to your side, and then grab a block or two. So now we're going to get into hip extension. So hip flexion, we covered when we were first laying down, lifting the leg up. Okay, so everybody's going to have a recording to this. I would highly encourage you to go over the hip series again and just study how different your body feels side to side. Okay, so now having this block or two, I'm just going to turn around so you can see from the posterior end. I want your block between the ankles. So you should be able to do this. You don't have to, but that's where the placement is. Okay? So you sit on the block first, both sit bones, like this. Lean over to the right, step your left foot forward. So my left foot forward is in the lunge, I'm still sitting on my butt. So first part of our extension is we have to stabilize the knee. Spread the toes on your right foot and actively press all of your toenails down. Not with your hand like I just did, I was just showing you, but try to press your toenails down from the actions of your leg and foot. Look at the angle of your right thigh. So if I turn this way, what you want is your thigh to be going straight forward neutrally out of the hip joint. Avoid having your thigh end up over at the side. So remember, hip extension is the lengthening of the psoas muscles and the rectus femoris muscle. So first you lean back onto the hands, and then just take some of your body weight off the block. Where you went over this, remember posterior pelvic tilt. So as soon as you lift your body weight off the block, engage your butt and try to pull your butt into the body so that when you sit back on the block, you're not sitting on directly on the sitting bones, you're sitting more on the mid portion of your butt, right? So you're not sitting this way, nice and proper. Now you're starting to kind of like slump down like you're watching TV on the couch. Make sure your right thigh still stays in line with your hip. Keep the toes pressed into the ground. Maybe come down to the elbows. If coming down to the elbows has helplessly lifted your shin and you can't get it back down, come back up onto the hands. Okay? And again, once you're on the elbows, if you get there, lift your body weight off the block a little bit, pull your butt into the body, and land still a higher part of your butt onto the block. So we progressively end up off the sitting bones. And you can stay here. This is good. If you want to go for the full pose, take the block out, bring your butt to the mat, and then you can lay down on your back. But as long as you keep your right shin on the floor and your right thigh stays in line to your right hip. So this is one of these primary restrictions that lead to so much low back pain. It's the tightness that we all feel here, to varying degrees. So what you're feeling in quadricep, what you're feeling right here at the front of your hip joint, the front of your hip crease, that is the restriction that leads to compression in the low back and compression in the hip. So by lengthening your psoas, you're also decompressing the hip as well as the lumbar spine. And those of you that have lower back, if you wake up with lower back stiffness, go through these hip series and highlight this last one, hip extension. For the last couple breaths, actively try to press your shin into the floor. and you'll feel how your butt comes online. So try to press your knee and shin down, and you might feel your butt lift a little bit. So that means you're on the right track. And then you really feel a big tightening up, a bigger stretch response on the front thigh and the hip flexor line. Make sure you're exhaling fully. Your psoas muscles connect by their fibers to your diaphragm, the main breathing muscles. So if you have a restricted psoas, it tends to restrict your breath, which means when you're mobilizing and stretching the psoas, it's good to keep the breath full and complete so that the tightness of the psoas being stretched doesn't start to shrink your breathing capacity. Okay, and then slowly come on up, elbow by elbow, hand by hand. Come forward. Stretch your right leg back just for about 3 breaths to get your quadriceps to reactivate and your knee to reset. And then side 2. So again, you sit on the block. Step your left foot forward. Excuse me, right foot forward. Make sure that your toenails press into the floor firmly on the left foot. Make sure your left thigh stays in line to your left hip. It doesn't veer out to the side. Lean back onto the hands. Lift your body right off the block. Pull your butt in. Land a higher part of your butt down. Those of you that are going on, next step, elbows. Once you get on the elbows, again, press down. Lift your body weight off the block a little bit. Pull your butt in further. Land a yet higher part of your butt on the block. And those of you that have the clearance, you can take the block out. As long as when your butt comes to the floor, your knee hasn't lifted, you can then lay down on your back. But irrelevant of how deeply you go into these poses, you just want to be able to meet that edge. And that's it. We're just meeting the edge of our flexibility. And it's just by virtue of repeating these things over and over again, like if you did this every day for the next 10 years, your body would be helplessly rendered more flexible. And so flexibility is the outcome of repetitive movement, just like strength is, right? You want to get a bigger bench press, you want to be stronger in your chest, just repeat the damn bench presses. Same thing with your flexibility. You want to be more flexible somewhere, you just practice and you keep meeting your edge until those muscles expand. Everybody press your left shin into the floor, press your left knee into the floor, and you might notice how your butt just kind of has a little release of its weight from the ground. You can engage your glute, and then you'll really feel a bigger zap of that left quadricep and hip flexor line. And you might want to reflect on whether this side feels tighter or the previous side did. And so for all of you going forward, what you want to do is remember where you're asymmetrical, where you're more restricted or more flexible, and work to balance it out. Okay? Slowly bring your elbows to the floor, come up hand by hand. Okay? And then straighten your left leg back, get your quadriceps active and your knee to reset. Okay, so that was the first part of our hip extension. Now I'm going to actually have you find a little bit of wall space. So if you don't have wall space around you, you can always use a chair, or you can use like a little footstool or something. You can use the edge of your bed. So here's what we're going to do. So I'm going to use this wall. I'm going to put a little bit of mat down just so my knee doesn't slip. So I would suggest slide your mat up to the edge of your chair, footstool, bed, or wall, and then put a blanket right on top of the mat. So you cushion your knee. Okay, let me see where everybody is. All right, brother David, this is your favorite. Okay. So here you are. You're going to start on all fours. Starting with the right leg, I want you to put your shin on the wall and then slide your knee down until your knee gets to the blanket. So your knee is both touching the wall and the blanket at the same time, okay? Okay, and then walk your hands in. If you need a block for this, you can use a block, but as soon as you walk your hands in, I want you to step your left foot forward between the hands. If that's too much for you, you can put your hands up on some blocks, you get some ground clearance, and then step your left foot through. So either way, starting with your hands on the ground, first, we're just gonna get into a little bit more quadricep flexibility. So you're gonna press your butt towards your heel. If your butt contacts your heel without much trouble, then try to take your butt to the wall, but make sure you stay just on the inside of the heel. So you can see what I'm doing with my finger is if I slide my finger right through my inner heel, the outer hip and the inner heel should have firm contact, so there's no space there. Right here. So you're pressing your butt to the wall, and you'll feel how the state of your quadriceps right now. If you can get your butt to your heel, according to modern medicine, you have good knee flexibility, good quadricep flexibility. So here we're stretching the quads because the knee is flexed. The action of the quads is to straighten the knee. So to stretch them, we gotta bend the knee. So part two, this is when we get more into the psoas. Walk your left toes forward a little bit, still keeping the hands on the ground. Now take your butt away from your right heel. So before you were pressing the butt to the heel, now see how far you can take your butt away from the heel, which means that you're continuously attempting to lower your right thigh closer and closer to the ground. Keep your right butt engaged. Remember, not only are you now lengthening your rectus femoris muscle in the quad, you're also starting to lengthen your psoas because your thigh is going posterior to the pelvis, okay? So if you engage the glute, you'll actually help to turn off the tension in your hip flexors. Right? If this is easy enough for you, you can take it one step even further. Only if you like, you can put your hands on your front thigh and then come upright. And if you can get to this position, it's imperative that you keep your butt on the right side engaged so as to keep allowing more extension at the right hip. And if you come upright, if you didn't feel anything before, you're guaranteed to feel something now. So notice how dense this is. Basically, notice how uncomfortable this feels. And so what we can derive from this is the purpose of yoga isn't to practice things that are just comfortable. It's to actually confront tight and unaddressed parts of our anatomy. And part and parcel of that confrontation is you're going to have to face uncomfortable sensations. Because it's uncomfortable sensations that your body uses to communicate if something's wrong. Bring your hands down. Bring your left leg down first. Right leg down next. Good. And then let's start with the left leg. Bring your left shin to the wall. Knee to the blanket. Walk your hands in. Step your right foot forward. Keeping the hands on the ground. Just press your butt to your heel. And if your butt gets to the heel, then try to press your butt towards the wall. Make sure that your left toenails are still pressing into the wall. That way the deep structures of your ankle are stable, which protects your knee. Now, walk your right foot forward, and now take your butt as far as you can away from the left heel. So it's like you're courting the ground with the front of your left thigh. Engage your left glute while you do this. The more you engage the glute, the less resistant those hip flexors will be. And you might already notice that this side, hey, it's like more tight here. Maybe the previous side was more tight. Now remember, when we're doing what we're doing in yoga is we're not just trying to create flexibility, we're really creating symmetry. Most of my mentors through my training are physical therapists. And what every single one of my mentors always imparted to me is that pain and dysfunction, anatomically speaking, was never because the person wasn't flexible enough or just wasn't strong enough. It's asymmetry that's at fault. So it's the fact that, say, with this pose, in this movement, it's the fact that your left hip flexors are tighter than the right hip flexors. That causes asymmetry that then distorts your joints. If you're symmetrically tight, think about it this way. It's healthier to be symmetrically tight than asymmetrically flexible. So whatever side feels worse here, that's the side you actually want to practice more of in order to catch it up to the flexibility of the easier side. And if you did so before, you can come up into vertical position, both hands at the front thigh, and then still continue guiding your left thigh to the floor. Engage your left glute, keep the breath deep. This will definitely provoke some shakiness, some sweating, and of course, don't push so far into it that your breath just gets arrested. Generally speaking, we want to keep the intensity scale of about a 6 or 7 out of a 1 to 10. Okay, and then slowly come out. Very good. And then have a seat. And just to close off, I want to bring your attention to the bottom of page 8. So this thing here. And why I want to do this is, I think another little bit of misinformation that isn't necessarily perpetuated consciously by teachers. It's misinformation that we are tempted to presume is the case, because what we hear a lot from our yoga camp and yoga culture is keep meeting your edge, keep meeting your edge, right? You get like a full splits, and once full splits isn't a problem, you gotta keep meeting that edge. You gotta keep meeting that edge. And there comes a stopping point where you don't want to keep provoking deeper and deeper movement, because then it actually starts to conflict with the parameters that your hip joint can exist within, right? Your hip joint doesn't have totally free, untrammeled range of motion, right? It has 6 degrees of movement, but even they have their limitations. So this is where this small little table on the bottom of page 8, this shows the arthrokinematic, right? Arthro means joints, kinematic means movement. So this shows the arthrokinematic limitations on all 6 directions of your hip movement. So hip flexion, medically, clinically speaking, is healthy if it only, well, I don't want to say only. Medically speaking, it's considered that if you can take your hip flexion to 125 degrees, that's healthy. And going past that isn't really necessary. Now, it doesn't mean that you can't go past it and be safe,
But this is kind of, think of it as the bare minimum table. And if you can get these bare minimum angles and movements, then your hip joint is considered safe. So if you look at extension, hyperextension, don't look at extension because that's a little confusing. If you go into hyperextension, it shows from 0 to 15 degrees. So functionally, clinically speaking, this is 0 degrees, and this is about 15 degrees. So this is about all your hip, bare minimum that it needs to extend back in order to have good extensive function. Right, and you can take that down to abduction. So abduction goes from 0 to 45 degrees. Any further than that, is it necessary? And you want to be careful. So these are the bare minimums. So if you push past the bare minimums of each of these joint angles, you have to be exceptionally safe on how you do it. But that kind of goes a little bit beyond the scope of this basics workshop because I want to just get the basics down, which means the bare minimum. What is it that we bare minimum need to know in order to have a good functional movement of the hips? And then if you go to page 9, at the bottom, life versus exercise. Now, the hip is obviously something that we use throughout our life, all the time. It's not just something that comes into play in yoga, which makes a connection right back to the first message that we started with. This practice is there to enhance our life, not to keep enhancing the practice, right? We practice and move to live better. We don't live just to practice better. And so the distinction between lifestyle and exercise is really not that big. It's just that we want to prioritize function essentially. We're not prioritizing deep ranges of motion in big stretches for their own sake, because that can eventually become dangerous. And then at the bottom where it says lifestyle factors, people always ask, what can I do to enhance my yoga practice? What can I do to like make my hips feel more flexible? Now remember, you're going to practice at most, right? Like Brother Paul at most probably practices 2 hours a day. And that's pretty rich already. So most of us probably get an hour a day, sometimes not even every day. And if you think about an hour practice a day or a 2 hour practice a day is still such a small part of your day. It's 1/24th or 1/12th of your full day. So to expect our life and our joints to function well when we give them 1/24th or 1/12th of our daily attention, it's kind of a fool's errand. So what this means is things that we do every day are actually in support of our hip health. So what supports good joint mobility? First of all, it's hydration, nutrition, and rest. You've got to drink your water. You got to get your fluids. That's inescapable. If you don't have enough fluids in your body, forget about your joints. It's just, you can't match them up. You're not giving your joints their underlying substructure, right? Your cartilage is essentially made like 80% water. So if you don't have enough water, you're not giving your cartilage its substrate to be able to replenish. And so how would you expect for your cartilage to remain healthy? Nutrition, obviously, we got to supply our body with the right ingredients so that it can create more tissue because your body has to regenerate to be healthy. And rest, and I put rest and meditation hyphenated because in one sense it means sleep, but just because you can get adequate sleep doesn't mean that you're psycho-emotionally rested. And this is where this big part of meditation, the whole purpose of meditation comes into play, which is mental stability, emotional stability, which has been shown, which has been proven to really expand and to develop in the mindfulness practices of these Eastern traditions. meditation. Meditation, breath work, it's strategic practice of quieting. Because we're bombarded with a lot of information, a lot of media, especially now, right? And then intelligent movement. So this is where we take our practice into life, right? It's not like we show up to our mat and everything is good and we're so proper and it's like, yes, we're just great and everything's just perfect. And then as soon as we're done with the mat, we just walk around like slobs again, right? We want to be able to take the principles, the intelligence of all of these movements into our daily life. And again, it's beyond the scope of this practice for us to talk about gait mechanics, walking mechanics, squatting, things like that. But other forms of exercise are not different from yoga. And this brings us to the last part, yoga versus calisthenics. What's the difference? Ideally, there is no difference. And this is, again, something that yoga culture isn't really clear. It's not really, you know, obviously because there's a commercial aspect to yoga and we have to pay the bills and keep studios open, that we kind of tend to hear the message that yoga is the panacea, it is what's going to create balance. But if we look at traditionally, what is the definition of yoga? All you look at is, on that second point, the Yoga Sutras. This is the classical definition of yoga. Yoga is chitta, vritti, nirodha. So, which means yoga is that state when your mind is completely immersed in your present moment. Yoga is the state where your actions are not divorced from your attention. So the example is, you can be walking down the street, but you can be thinking about all of your credit card debts. So that's where your action is divorced from your attention. And as soon as we bring action and attention together, that is actually the definition of yoga. So that means walking can be yoga. That means petting your dog can be yoga. That means making love to your partner can be yoga. Swimming, surfing, gardening. So we don't need to create these boundaries where yoga can only happen on this mat at this time of the day. Eventually, we expand that circle and we make our whole life, our whole world, one big yoga mat. And wherever we step, whatever we do it with consciousness and intention. Listening to music can be just as much a yoga practice as doing sun salutations. So that is the end of that. I apologize for going over on time a little bit. Thank you guys for your patience. I'm assuming you guys have other things to do, so feel free to get going. I'm going to send out a recording to this, and if anybody wants to stay and ask some questions, I can hang out for another couple minutes and get to those. I think that it'll probably be useful to do a part 2 of this workshop, just to see how all of these movements that we went over, the 6 classical movements of the hip, how they play into the constantly repetitive postures that we do in classes. Because we went over it in brief laying on the floor, but obviously our practice is so much more than that. So anybody have any questions, you'll just have to unmute yourself and ask away, but otherwise, if you have to get going, thank you. Thank you for your patience. Thank you for your attention. You guys are awesome.
Thanks, Elia. Hey, that's my wall behind me right there.
Nice, bro.
Can't see it? It's got the hooks and everything.
I can't see it.
I'll send you pictures.
Okay, awesome. Congratulations.
Thank you.
Those of you that are interested in building a yoga wall, I know a lot of you do, feel free to email me and we can talk about that. Even if you're in Canada, we might be able to strategize a way for you to get a yoga wall set up. But I teach Monday private group class with a yoga wall for those that have it. So, all right, you guys. Any questions? I'll just sit here and wait. Otherwise, I'll see you next week.
Hey, I got Brian here. So the 0 to 15 degree thing with the hip extension.
Yep.
On the wall, I feel like we're coming close to that or going beyond it. So what creates the internal rotation on the hip, on the wall?
Sorry, say that a little bit louder about the internal rotation part.
Yeah. So when you're nearing that
15 degree.
yeah, the 15-degree limit, you said to create some internal rotation on the hip,
Right.
to not have that rubbing on the joint.
Yes.
So what creates that when we're having our calf up the wall?
Okay, good question. So just real quick, what Brian's is asking about is hyperextension. If you go into hyperextension far enough, past 15 degrees is considered more of a deep extension. So up to 15 degrees is kind of like the bare minimum. So what I would say, if I put my computer over here, let's see if you can see this. Okay. So how you would set it up, because your leg is already kind of locked onto the wall, what you would want to do is preset your foot to be neutral, so you can have your knee medial to the foot, right? So if my foot is lateral to the knee, the thigh's already internally rotated, and that way when I go into hip extension, there's no way that that leg is going to be able to externally rotate, because external rotation would mean my foot is to the inside of the knee. So if you keep it in line or lateral to the knee, then that internal rotation will already remain in place as you go past or up to that 15-degree range. Does that make sense?
Yes. Thank you.
Okay. Yeah, good question.
I have a question.
Yes, ma'am.
All right, so in a normal Parsvottanasana, I've taken some hot yoga classes where they tell you to go into spinal flexion and a posterior pelvic tilt, but it sounded like what you were saying was that was contraindicated.
So they told you.
Yeah. So you're
They told you to go into Parsvottanasana. So
like this.
So this pose,
Yeah.
and then told you to
This one.
rotate.
Posterior pelvic tilt and spinal flexion.
Yeah. I don't know what to say to that.
Well,
I mean,
you basically said that's not a very good idea.
Right. Right. Because when we're moving the hips, you want to isolate as much movement into the hip as possible. If I'm here, but I posteriorly rotate, that's me putting my pelvis back to neutral. So I want to avoid bending my spine as long as possible. And if I don't bend my spine, the only other place I'll have a choice to bend is at the hips. So in Parsvottanasana, that's why you want to try to accentuate the extension of the spine as you come down. Once you can't go any further, then you round your spine at the end. But yeah,
Okay.
never really rotate in flexion.
Thanks. Then I can refuse to do it if I ever get back to a regular yoga class.
Refuse away.
And are you giving an online wall class?
Yep.
Yeah, it's awesome.
Yeah, Brian goes to it.
Really?
Yep.
Well, can I have the information? I have a wall.
Yeah, I'll send you an invite.
Okay, thanks.
Cool. All right, you guys, so no more questions.
Thank you.
So lovely.
Much love.
See you soon. Bye, Nikki. DJ. Later, bro.
Appreciate it.